One concern that constantly comes up, especially as a child gets older, is the relationship that a parent has with their child with a disability of any sorts, and especially with autism. Autism is so tricky because they look so neurotypical. There's not very much about them that you can, even as a parent, knowing that you have a child with autism, it's still so hard to take that part of your brain and say everything is different, right? And it tends to be that most things are different. I'm not taking it away. You can still live a full and happy and complete life with autism and with a child with autism. So I don't want you to think that I'm saying that because a child has autism, that you won't be able to live that full life. You can. However, as human beings, we still have a hard time processing what exactly that means. So I have lots of parents who have concerns about how their relationship is going with their child. In fact, I see lots of parents who have been having, their child has only been receiving mental health therapy for the last year, and they haven't been making much progress. So those are the ones, I love those families because I can then work together with that mental health therapist and we can start talking about where they're actually understanding, where their receptive skills have maxed out. He looks like he's 14, but his receptive skills are still down here where he's 7. And so we're talking to him as he's 14. He should be able to understand. First, you have to do the dishes and wash the car, and then you can do an hour of video games. He's 14. He should be able to understand that. But we see often that he's at a 7-year-old level. We have to do some things very, very differently about that. Maybe he needs a visual. Maybe he needs to be able to see what exactly is expected out of him because his receptive skills are so tricky. So that creates a huge difficulty in your relationship if we put these expectations on our child and he's not there. And so a speech therapist can help you to be able to determine where he is. We have some fabulous standardized assessments that we use. So a standardized assessment is simply just a test that they gave to hundreds or thousands of children that are of all different ages, and then they get kind of the same answers. And it can be across the country, it could be across the world, depending on the assessment that you're giving. And so what they do is they just take all of these answers that children have been given and they decide, oh, okay, we can see that clearly most of the children are right here. So if they're on this end or if they're on this end, they're either, really, really high. We don't see these answers very often, or they're going to show me some deficits. And so we take these awesome standardized tests that we have and we're able to kind of really tell you, okay, your child is understanding spoken paragraphs at a 5-year, 2-month-old level. And I feel like this has helped my parents so much to know I can't talk to my child like they're 14. I have to talk to my child like they're 5. Does that mean that your child is unintelligent? Absolutely not. Your child probably has incredible intelligence with creativity or understanding video games or, understanding how things move very quickly. Your child, it doesn't take away with how intelligent your child is. That simply means that as far as understanding language, they're having a hard time. And so in order to be able to access your child's intelligence, we need to understand where they are language-wise. Because without that understanding, we put them we peg them. Okay, this is where they are. They're 14, they're not doing this, they don't have any interest, they can't make friends. We start to talk about all of these things. Well, really, that's not the case. He's 14, he's having a hard time because he's at this level, and we need him to be able to access that information better. And so that's where your speech language pathologist is going to come in. Language is really tricky to teach. It's really hard. I would say that language is not something that you can teach at home. It's something that you do absolutely need the guidance of a speech language pathologist in order to be able to access the correct pathway to understanding the information.